Oh, hi there everyone, it's Linda here from Just For Tummies. Welcome to my video, The Aging Vagina, and I am going to have a guest with me today. It's Jane Barrett, nutritional therapist. So I'm going to invite Jane into the video now. Hi there, Jane.
Hi Linda, how are you?
I'm good, thank you. How are you?
Yeah, good, really good today, thank you.
Looking forward to the spring.
Yes, yeah. I thought you were going to say you're looking forward to talking about vaginas, and the answer is yes.
Yes, absolutely, that as well, but looking forward to lighter nights and lighter mornings, snowdrops and daffodils.
Indeed, indeed. But I love the winter, I have to say. But yeah, looking forward to the spring.
So do I. I love the winter. I,
Mm.
um, I've always loved the winter months. I don't mind the dark nights, the dark mornings. They don't bother me. I don't seem to get sad, seasonal affective disorder, and I think it's down to when you're born. The month that you when were you born, Jane?
June.
Oh well, that's my theory gone out of the window. Then because
Oh,
I was born in February, you see, which is a cold winter month.
oh no, I love it. I love the cold nights. I love the cold. I love the rain. I love the wind. I'm a bit unusual, but yeah, I love it.
I'm going to make us a little bit bigger. There we go. So people can see us, Jane. So I've just introduced you just as Jane Barrett, nutritional therapist. And before I get you to speak a little bit about who you are, what you do, and why you do what you do, I'm just going to briefly explain to people what we're going to be covering today, so they know at the outset, what this video entails. Okay.
Yeah, good
So
idea.
the video is called The Aging Vagina, and we're going to be looking at, well, how the menopause affects a woman's intimate health, in particular the vagina. What makes for a healthy vagina? Um, how is a vagina affected by aging and by hormones? What health issues can vaginal dysbiosis lead to? What can women do to enjoy sex without it being painful? Uh, can HRT prevent atrophy of the vagina? How can women get UTIs more than men, and why an increase in the menopause? Conventional treatments for UTIs are antibiotics and bladder installations. What are these? Um, is there a difference between an embedded UTI and a standard UTI? If so, what? Does HRT have a role in preventing UTIs? Can you tell me about the vaginal microbiome test and the new urinary microbiome test? That's interesting. And so two different tests.
Mm.
Okay, right, great. How can we give some TLC to our vaginas, and what can women do to reduce their risk of getting a UTI? So that sounds quite a lot, doesn't it, Jane? But fantastic information. So we'll just crack on then, if you don't mind.
Yeah, no, absolutely. Lots to cover.
If you can tell people who you are, what you do, why you do it. I mean, I know you specialize in digestive and gut health, but why did you decide to add vaginal urinary health to your arsenal?
Yeah, no, good question, good question. So I'm a nutritional therapist. I specialize in digestive health, and I've been qualified for 8.5 years now. And I've always had an interest in nutrition going back a long, long time. I mean, in the 80s, my mum was into it. Also in the 80s, we were eating everything wholemeal, we were taking probiotics, and we were doing all of that. So I've always had an interest. And then I had years of thrush. I spent one summer on fluconazole, the antifungal, for the whole summer. I came off it and all my symptoms just came back. And I thought, right, I need to sort this out. I need to not cover it up with a sticky plaster. I need to sort it out from inside underneath.
What age were you then, Jane?
That was in my 30s.
Okay.
So I decided then that I would just change my diet. So I Googled it. Wouldn't recommend that, but I Googled it, changed my diet, and overnight symptoms literally disappeared. But then I got to a stage where I thought, I need professional help. I need to know what supplements to have because there were just so many. And I had a free call with a nutritional therapist. I burst into tears on that call. Long story short, I worked with her. And then about 3 months into working with her, I thought, right, this is what I'm going to do.
Mm,
So I went back to school for 4 years,
mm.
retrained, always knew I was going to specialize in digestive health. And then 8.5 years ago, set up my own practice. And then over the years, because gut health, as you know, is the center of everything, it's absolutely the center of everything, particularly for the vagina and for the urinary tract.
Yes.
So I found that lots of clients were coming to me that had dysregulated guts, but therefore had dysregulated vaginas and urinary tracts. And because I'd had those, I'd had loads of UTIs before in my 30s and 40s, and I had had thrush non-stop. So I had that understanding of how awful they were. And it just has become really part of my work. And I think because I work with the gut microbiome, I spend a lot of time doing all of the extra research and the learning on the vaginal microbiome, which is reasonably newer, and now the urinary microbiome. So that's how I've ended up becoming sort of more of a specialist in those fields as well.
Yes. When women contact me and they're suffering with IBS and with UTIs, I say, well, what came first? And very often it's the UTIs that came first, and then of course, you know, antibiotics for the UTIs cause them to develop IBS.
Mm.
And I'm sure you've heard that lots of times as well.
Yeah, and it can come the other way as well, because if there's dysregulation in the gut. But yes, usually it's that antibiotic history that is the key, isn't it, to starting the IBS symptoms?
Yeah, there are so many factors involved. So, right, so that's you then. So let's look at the difference between the vagina and the vulva. Let's do a little bit on the anatomy, just briefly.
Yeah, I kind of call this vaginal health 101 really, because there's lots of women that don't understand the difference between the vagina and the vulva. And the vagina is the internal part and the vulva is the external. That's the simple answer. So the vagina is an internal organ, it's a muscular organ, it produces lubricants basically to protect it from bacteria. And it starts with the external part, so the outside part. The vagina goes inside, and then we have got up to the cervix, and then the cervix is like the gateway. So that's the top of the vagina, and it's the gateway to the uterus or to the womb. Yes. So that's the vagina, so the internal part. And then the vulva is the external part. So it's the skin folds, the labia on the outside that cover the urethra, which is where we wee out of, urinate out of, and it protects the vulva and the clitoris as well. So it's really important to have that understanding when we talk about vaginal or vulval issues, because they are similar but different.
So the vulva then, the folds, the skin folds, I'm assuming that when we begin going through the menopause and they begin to shrink, don't they? That they can, that it can increase UTIs because that protection, that physical protection, is disappearing.
Yeah, it's more to do with the thinning of the tissue.
Yes.
Yeah, absolutely. It does, and it's really sad to say, but it is like it sort of shrivels up.
Yes, I know. Well, I'm 63, so I know that.
Yeah, me too. I've done that. Got the t-shirt.
Yeah. Some women have this vaginal rejuvenation procedure, don't they?
Oh,
Do you
goodness.
know anyone that's had it?
I don't know anyone that's had it, no.
I don't know anyone that's had it, but it is a surgical procedure.
Is it like a facelift for vaginas or something?
I think so. But I think what it is, it's all about stimulating collagen, you know, to sort of plump everything up again. No thanks. Right, so what makes for a healthy vagina then, Jane?
Yeah, so you mentioned collagen, that's kind of number one. So we think of collagen with our face, don't we? We think of collagen nice and plumping everything up. But collagen is a bit like, it's like the structural framework, effectively. That's probably a good way to explain it. Collagen and elastin. So the pure name of elastin, think elastic. So elastic keep things stretchy and in place, yeah? And that's effectively what collagen and elastin does. And that's really prevalent in the childbearing years. So we have lovely strong vagina effectively due to the collagen and elastin. So that's number one, the kind of that's called the connective tissue, the collagen and elastin. The second thing is the microbiome, what makes a healthy vagina. So we've known about the gut microbiome for decades now, haven't we? I mean, decades. We really have. It's reasonably advanced in its knowledge. But the vaginal microbiome is far, far behind it. So we've probably known a huge amount in the last 5 years. So it's reasonably new, but the understanding is certainly there. Now, with the gut microbiome, we need a variety. We need a large diversity of bacteria of all different types of species and strains to keep it healthy. But the vagina is actually the opposite, and we need a dominance of one particular species.
Yes.
And
you mean the lactic acid bacteria?
Yes, the lactic acid bacteria. So the vagina is a really complex ecosystem, actually, and it's really important that we have the lactic acid bacteria, so they're the lactobacilli, because they help to protect the vagina from any opportunistic bacteria. But also, most importantly, they are keeping the pH at the right level for the vagina. So that's really important. If you think about the pH scale, so as you're looking at it on the left-hand side, it's very acidic. It's sort of 1 or 2, and then in the middle it's 7, which is neutral, and then on the right-hand side it's 14. So where 7 is neutral, and where, for example, hydrochloric acid, so your stomach acid, is between 1 and 2, so extremely acidic, the vagina likes to be around 4. So it's quite acidic, and it needs that acidity to fight off any opportunistic pathogens that might come along.
Can I just jump in, Jane? How is the vagina colonized with lactobacilli bacteria? Is it at birth?
Good question, actually. We do inherit our microbiomes from mothers, for sure, and we inherit more of it if we've been born vaginally. Whereas if we were born by cesarean section, then we don't have as much of it. But it's equally making sure that we feed our gut.
Yes,
is just as important, because, as I'll come on to talk about, our gut is a reservoir also for other bacteria that might translocate into the vagina and to the urinary tract. So we really need to focus on the gut, because that's what makes the big difference. But equally, not to be going and poking around in the vagina as well and upsetting the pH.
No. So thank you for that. Then. So back to the pH again. So it needs to be around 4. The vagina.
Around 4, yeah, 3.8 to 4.6 roughly. So we want it acidic, and then if it starts to go more alkaline, so towards 6 or above 6, then we can get other types of infections, such as bacterial vaginosis. So yes, we want to make sure that we keep it in a nice healthy pH, which is what the lactic acid bacteria do. So it's the lactobacilli species, the name lactic, and the lactic acid is it's antibacterial effectively and antiviral.
Okay, right. So what about hormones then? How do hormones affect the vagina?
Oh yeah, that's a biggie. So it's mainly one old hormone, so that's estrogen. And estrogen is suddenly in puberty. So when a girl is maturing into a woman, then estrogen suddenly becomes the dominant hormone, and it provides lovely vaginal secretions. It's a very protective effect. They've got very strong vaginas, effectively. The tissue is beautiful and plump. And along with that, stronger collagen as well, because their collagen, their structural matrix of the connective tissue is also really strong at that age. But sadly, it goes into decline when we then get older, into perimenopause and then menopause. That's when the hormone estrogen declines, and then we start to get more of those symptoms.
And what's the average age, would you say, Jane, when estrogen begins to decline?
So it can do from as early as 35, but usually most women tend to find it's more mid to late 40s, really. But it does depend. Some women can, it depends how high your estrogen was in the first place, whether you were someone that naturally had high estrogen, then it's more noticeable when it drops. But generally it's in the 4th decade, generally, yeah.
Okay, great. Right, so how is the vagina affected by aging? What happens to the structure of the vagina?
Yeah, so that connective tissue, that lovely collagen that we want, it effectively loosens. It loosens with age. So as we see in our skin, it gets saggier and more wrinkly. That's effectively what happens in our vaginas as well. And because that elastic, the elastin, because the elastic doesn't hold things in place, we're more likely to get things like prolapses as well.
Yes.
And the bacteria that lines the gut can translocate across tissues to the vagina, and that's more likely if the tissues are thin and,
Yeah.
and the walls are thinner because of that lack of connective tissue holding it together, like elastic.
And I suppose the same can apply with the bacterial translocation into the bladder.
Yes, exactly. The gut and the vagina are reservoirs for the bladder. Yeah, definitely.
Okay. So lack of collagen, loosening connective tissue, risk of prolapse. The bacteria lining the gut and vagina can translocate across tissues, and that's more common in menopause because of the thinner tissue walls, right? And then lack of estrogen, peri and menopause, and then into postmenopause. So those vaginal walls start to thin and lose their plumpness, and that can create dryness, can't it?
Yeah, so the hormones is the second part of how the vagina is affected by aging. So firstly, the change in the collagen structure, and then secondly, the hormones. So the estrogen that I mentioned earlier, that just plummets, or doesn't plummet, it starts going down in perimenopause, or in fact in perimenopause it goes like this.
Yes.
It goes up and down. It doesn't know what it's doing. So one minute your vagina's feeling lovely, and then the next minute your vagina can be feeling really uncomfortable because of where that estrogen is. But it is most noticeable when you are getting close to menopause and postmenopause, because by that point your estrogen is very, very low.
Yes.
So and actually for the first 5 years after menopause as well, it's still declining. Although it's very low, it's going to almost like non-existent. And of course, we just lose that lovely plumpness, and it creates a dryness, like an irritation. It can, it's the term is vaginal atrophy, which is such a horrible term, really.
Oh,
But
yes.
it's effectively it's just aging, so you can get very inflamed and very irritated, and it just makes the area really sore. So for about 50% of women will suffer with vaginal atrophy. Not everybody does. But it makes things like smears uncomfortable, or putting in a moon cup or a tampon, and certainly penetrative sex can be excruciating for some women, that they just end up giving up on it. So it can really have an extreme effect on a woman's quality of life.
Yes, I had the letter through last week actually about attending for my last smear.
Last one.
Unless, well, yes, because you don't have them after the age of 65, unless you request it. You can request to have one. But my last smear that I attended, which would have been about 3 years ago, I had no idea, Jane. Bearing in mind that I was 60 then, and I've been having smears since about the age of 18. I had no idea that they use different size speculums. Did you know? Did you know?
You can ask for a smaller one. Yeah.
No one had ever explained that to me, but I didn't have an issue with the smear. It was okay. It's not very pleasant, is it? But I've always gone for my smears. So yes, so when women are perimenopausal, postmenopausal, because of the physical change, well, not just the physical changes to the vagina, but kind of the chemical changes then increases the risk of more infections, of them getting a UTI. So how does that happen?
Yeah, so the vaginal infections do increase in menopause, and that's for various reasons. One, because of the thinning, the vaginal atrophy, that everything is thinner and less plump, but also because the pH can change as well. Sometimes the hormones can get a little bit upset. So, for example, bacterial vaginosis, a type of bacterial infection in the vagina, that often increases as we come into menopause. And thrush, or otherwise known as vulvovaginal candidiasis, that sometimes can decrease because that's largely estrogen driven. So when we have lower estrogen, sometimes the thrush is not as prevalent. However, we can still get that with vaginal atrophy as well. So it kind of depends if a woman has got vaginal atrophy or not as to, you know, what they're more likely to be susceptible to. And when we bring HRT into the picture, again, where we're putting back in the estrogen, that can change things the other way. So you could reduce your chance of bacterial vaginosis, but you could increase your thrush again. So it's a very fine, delicate balancing act. It really is. And every woman is very different.
So just let me get this right then. So the pH of the vagina should be around 3.84.
Oh, yeah.
If it increases in alkalinity, there's more of a chance of getting bacterial vaginosis.
Correct.
What if it becomes more acidic?
I don't think it really matters if it becomes more acidic, because it's quite happy to be acidic.
Yes.
Because if it's acidic, basically none of the pathogens will survive in the vagina to be able to cause a problem.
Okay, so it doesn't matter if it drops below 3, for example.
I haven't seen the research on that, but I don't believe that's a problem. I think it's more when it goes towards alkalinity that it causes the problem. Yeah.
Okay, that's great. Right, so you talk about the microbiome and about it being a sentry on duty and pathogens that may translocate. And that's why it's so important that the lactobacilli are always dominant in the vagina. So what happens when the vagina is dysbiotic? And can you just explain what vaginal dysbiosis means?
Okay, so the microbiome is all the bugs that live in your vagina, the good ones and the bad ones. So that's it's like the gut microbiome, exactly the same in the vagina microbiome. Now, when we have got the connective tissue that is loosening and the hormones that are lowering, the microbiome becomes even more important in postmenopause. And I like to liken it like sentry on duty, because they're effectively the guards that are keeping out these opportunistic pathogens that may have translocated from say, the gut. And this really is a time where it's really important for women to make sure that their dominant strains, the lactobacilli, are really dominant. So dysbiosis is effectively an imbalance of bacteria. It's where we have too many of the bad ones, or the potentially bad ones, and not enough of the good ones. That's effectively it. And that imbalance can affect a woman at any stage of life. It just happens to be often worse in menopause because of the imbalance of all the other things.
Just a random question, Jane. Do you think tampons affect the pH of the vagina?
I think it's really important to use natural ones, not to use the ones that are bleached. So preferably use ones that are natural colour as opposed to white ones, and certainly nothing scented. Or it drives me up the pole that you see these sanitary towels that are scented. I mean, why? Why do you want to put something so close to your vulva and your vagina that smells? I mean, it's an obsession, I think, and it probably sells them. But no, we want to keep anything that goes inside the vagina or close to the vagina as natural as possible.
And of course, to change them frequently.
Definitely change them frequently. Yes.
So, so vaginal dysbiosis then. So that's bacterial vaginosis, thrush, the vaginal vulval itching, and so when it comes to UTIs, then UTIs are very, very unpleasant. You know, with the symptoms of a UTI, but UTIs can also cause other issues for women, in particular miscarriages, infertility, and preterm births. Why would that be, Jane? What's the connection there?
So the vaginal microbiome we now understand it has lots of different opportunistic bacteria that can live in there. And the research is now showing that some of them will trigger certain issues within a woman's health. So we know about bacterial vaginosis and thrush. They're probably the two most common infections that we see. But equally, it can just be a woman that's got vaginal or vulval itching. So that can be caused by the bacteria as well. UTIs, we know that there's one particular one called Gardnerella vaginalis that lives in the vagina. We know that particularly can trigger UTIs. And we do know that there are certain mycoplasmas as well and bacteria that can lead towards miscarriages, multiple miscarriages, infertility, endometriosis, and having and preterm births. So the research now is incredible. So the way that we can look at the whole balance of the microbiome to see what particularly there might be that might put a woman being susceptible to this, particularly if someone's come to me recently, she's had 3 miscarriages. So we're doing a vaginal microbiome test on just to see what's going on there and whether any of the bacteria that she's got resident in her vagina may be causing her issues.
And does she have a history of UTIs as well, or thrush?
No, actually, she's no, she doesn't actually. She doesn't have a history of thrush. She's probably had the odd UTI, but nothing of great history. No.
So I'm just trying to understand then where the connection is with fertility issues and with miscarriages. So are we talking about bacterial translocation from the gut vagina into the uterus?
Yeah, definitely. So we can have the bacterial translocation from the gut mainly. So mainly from the anus coming into the vagina, and there's quite a lot of those that are present in a normal gut microbiome, but we certainly don't want them in the vagina. And then the research shows us there are certain species and strains that have been known to cause lots of issues to do with the woman's reproductive system. Yeah.
And does this research in the gut microbiome show that there's a lack of diversity in the gut microbiome, where the dominant species are the more pathogenic species, or is it more the balance of the microbiome?
Well, in the vagina, it's the main issue in the vagina is if it's not dominant in the lactobacilli.
Yes.
So if it's dominant in the lactobacilli, in theory, it should keep all of those other opportunistic pathogens at bay. That's in theory if our sentry are on duty. If the sentry have departed and we don't have enough of the lactobacilli in the vagina, then that leaves us far more open to any of these ones that have usually translocated from the anus, the rectum, into the vagina, which of course happens even more at menopause when we got these thinning tissues.
Are you seeing more issues with infertility and miscarriages then, Jane, that could be connected to a dysbiotic vagina?
It's hard to say in my practice because traditionally I have people coming to me for gut issues. But equally, I have had numerous clients over the years that have had lots of gut issues and have had difficulty getting pregnant. And once we sorted the gut issues out, they have then got pregnant. So I have seen that in my practice, not in huge numbers because that's not generally what people come to me for.
No, really.
But yes, I think there does appear to be. I think the more that we understand the vaginal microbiome and understanding, because things like miscarriages can be caused by thyroid issues as well. So there's so many different issues. But I think that the vaginal microbiome is definitely one of them that we have much more advanced understanding on.
I suppose it's another one of those taboo subjects, isn't it? Like the gut, the vagina. Maybe women women don't want to talk, want to admit that they've got a problem with it, if indeed they know they've got a problem with it. Okay, sorry. Go on.
No, that's true. I mean, women don't often know. Sometimes if women's just had a same discharge, she just thinks it's normal. She might not know that it's unusual for her. So, for example, bacterial vaginosis, one of the most common vaginal infections, will give you a white or a grey or a green discharge. And you might get a fishy odour as well. That's really common with bacterial vaginosis, and itching and soreness. But something like thrush will give you a white discharge, so like a cottage cheese, quite a thick cottage cheese discharge, and itching and burning like bacterial vaginosis. But you could also get rashes as well with anything that's sort of fungal, like a candida. And the latter, the thrush, is more estrogen driven, so that's more driven by hormones, whereas bacterial vaginosis is not. But every woman has very different mucus secretions and smell, and a lot of it is quite normal. So it certainly shouldn't be covered up with fragrant things.
No, it shouldn't. I was writing a newsletter yesterday, and I mentioned in it that, I mean, I'm 63 soon, and I've only ever had one UTI. Even if I could call it a UTI, it was back in my 20s, and it was typical symptoms of cystitis. You know, that drawing, dragging feeling, and then when I went for a wee, I just passed like a teaspoon, and it was really uncomfortable. But it only lasted for a couple of days, Jane. I didn't even bother going to, you know, to the doctors or a chemist even, and it went away. I've never had one since.
Wow.
So, but it is very
Impressive.
difficult, isn't it, for a lot of women. But you know, I've always taken probiotics for decades. I've always taken supplements to support my immune health as well.
Well, there you go. That's primarily why you haven't suffered with it. But you're absolutely right. It's really debilitating. I mean, I suffered with them for quite a few years. I never had them recurrent. I'd only ever have one a year or so. But it's still a vicious cycle when you have to take antibiotics.
I was on holiday at the time, and it almost it would have ruined my holiday if it was more than 2 days. But luckily, you know, it was just for the 2 days. Right. So, how can HRT prevent atrophy of the vagina? Did we touch on that earlier? I think you did briefly. The estrogen connection.
Yeah. So, the atrophy of the vagina, we can look at using vaginal estrogen.
Yes.
So that's something you need.
As in topically.
Yes, it's local, so it's used locally. So it's not topically because it's actually inserted into the vagina.
I see what you mean. Yes.
So we have vaginal estrogen. So the trademark names are Vagifem and Ovestin. So Vagifem is a tablet that's inserted into the vagina in like a little pellet, and then Ovestin is a cream that you rub in, and they are local forms of HRT, so they will only have effect on the local vaginal tissues. They won't affect any of your menopausal symptoms that you have elsewhere, won't touch a hot flush or anything else, but they can be really useful. Now that's a conversation for a lady to have with her GP, and to work out the risks. It's a very, very low risk. It's usually the reward is much, much greater than the risk in those local vaginal estrogens.
And when would a woman use Vagifem or Ovestin?
So if they are finding that their vaginal atrophy is getting in the way of either sex, or it's just making them feel really uncomfortable, that it's difficult to insert a tampon if they're still menstruating, or if it's causing any issues, basically, with just, sometimes for some women it's actually exercising or movement it causes an issue with, to this severe extreme. So that's the vaginal estrogen, can be a very useful toolbox. And then systemic estrogen, so what we traditionally know as HRT, so that comes in either oral things or patches or gels or pumps. That's not usually used for vaginal atrophy. However, if a woman is she's tried all of the other things, then systemic HRT can be an option, because what that will do more is return the more of the secretions that get lost in vaginal atrophy. So yeah, there's definitely a role to play for some women, but I always say diet and lifestyle and first.
Yes. Okay. And I think we'll come on to that later, won't we? Tips on diet and lifestyle. So yes, a little bit of phys and anatomy then, Jane. How can women get more UTIs than men? Men can get UTIs, but well, in my experience, they're quite rare.
Yeah, well, the main reason that women are more susceptible is down to our anatomy. So we have a much shorter urethra, so the part where we urinate out of. So there's a lot. It's a lot shorter for the bacteria to have to climb up to from the opening of the urethra into the bladder. So that's why we as women are more susceptible to UTIs than men. Because of the vaginal atrophy, again, not in every woman, but in say 50% of women, because of the vaginal atrophy and the thinning walls, it does mean that we have a higher risk of translocating from the gut to the bladder. And of course, that's where wiping is really important, to make sure that we are wiping from front to back and not from back to front. So we are not bringing any of our fecal matter from the anus through to the vagina. And the same goes for things like sex toys or any sort of sexual practices that could mix up the two microbiomes. We certainly do not want any of our gut microbiome getting into our vaginas.
Yes. My little granddaughter Jessie, she'll be 3 soon. She's almost toilet trained now, which is great. So we've been teaching her, you know, when she has a poo, that this is how you wipe yourself with the toilet paper. Yes.
Oh, brilliant to do that from very, very early on. Yeah, absolutely.
Yeah, and also, you know, we every time she has a poo, you know, we clap and we congratulate her. We never make the smell, you know, we don't make it embarrassing for her.
No,
It's perfectly normal.
absolutely, absolutely. That's really important.
She
Really
can
important.
imagine our house.
Well, we love talking about poo, so it's quite normal for us, so it's good.
Yes. Okay then. So yeah, conventional treatments for UTIs are antibiotics and installations, bladder installations. So yeah, what are these, Jane?
Well, a bladder installation is effectively known as a bladder wash.
Mm.
It's outside of a nutritional therapist remit. It's something that's done usually by urologists. It's certainly not done at GP level. But what they do is they insert a solution in for about 15 minutes and then they release it out of a catheter. And what they're trying to do is to replace what's called the gag layer. So it's like a mucus layer in the bladder. So that is performed. I don't see many clients that come to me that have done that. I have to admit, they tend to have got they're at the urologist stage. But actually, Professor Malone Lee, who's I'll come on to talk about, he thinks that they don't work. So they just don't sound right to me. I have to say, I mean, I've not really looked in detail at the research of it, but it
What's actually in the solution then?
it's some chemical. I don't know what the chemical is, but
Not an antibiotic then?
I don't think it's an antibiotic. It's just a sort of a chemical solution. But I've also heard that they put heparin in it as well. So that heparin is like a type of blood thinner, isn't it? So yeah, so I'm not entirely sure how that works. But the conventional treatment mainly for UTIs is the antibiotics. And because so many women get UTIs and they have antibiotics, especially if they're getting it, say 3 a year or something, then they're getting a lot of antibiotic usage.
They are, yes. And it's increasing the risk of antibiotic resistance, which is a major modern health issue, isn't it? Antibiotic resistance.
It's a massive, massive issue. I mean, antibiotics are the first choice for UTIs and they can be extremely effective. So, I mean, for some women in pain, we're not suggesting they don't go and have them for sure.
No. It's recurring UTIs, isn't it? Yes.
But it's really important because they are the first choice. So nitrofurantoin is the current first choice antibiotic that's now often given, because in the past, trimethoprim was the main one, but that's now largely antimicrobial resistant.
Yes,
so that only ever works is if they've cultured some urine and sees it's something that's particularly susceptible to trimethoprim. But other than that, it's not really used very much these days. I mean, I remember when I had it years ago, I lived on trimethoprim because that was the main one given. But what happens when you go to a GP? You go to a GP with urinary symptoms. They will take a urine dipstick test. If it comes back positive, they'll send it off to the lab, and then the lab will say, yes, there's an infection there. If there's an infection there, they will give you antibiotics. But if there's not an infection there, they'll say to you, no, you don't have an infection, despite the fact you might have symptoms and be really, really uncomfortable. But conventional medicine will say, no, you don't have an infection if it's not positive on the dipstick. But we now know that so much is missed not being on a dipstick.
Yes, yeah. So the dipstick test is just not fit for purpose, really, when it comes to testing for UTI.
It's probably half fit for purpose from a point of view that it does detect. It does detect them when they're really bad, but it doesn't detect them if they're rumbling or they're recurrent.
Yes, because some women are diagnosed with irritable bladder syndrome, aren't they? So what's the difference between a UTI, an irritable bladder syndrome? I mean, I'm sure you've come across that term.
Yeah, there's lots of different terms that they use. So we've got painful bladder syndrome, PBS. We've got interstitial cystitis.
Yes.
We've got UTIs, recurrent UTIs, chronic UTIs. So they're often all used interchangeably, and different people will use different terms. But cystitis, cystitis ends in itis, so it's generally inflammation. So officially, it's inflammation of the bladder. So when it's classed as itis, inflammation, it's technically not a bacterial infection.
Yes.
Which is what a UTI is.
That's right. Yes.
So that's really the difference.
That's a very good point. That's a very good point. But if a woman is presenting with symptoms, okay, just let me work this through in my head. If a woman is presenting with UTI symptoms, the dip test is supposed to ascertain if it is inflammation or if it's a bacterial infection.
It's just looking for bacteria. Yeah.
It's just looking for bacteria, right? So if it comes back negative for bacteria, but they're still getting symptoms, it's inflammation.
It's effectively inflammation, in which case they'll probably just say, oh, you've got cystitis, or they'll generally say it's sort of cystitis, or they just say that you haven't got one, and then, which of course you have got something, or something's uncomfortable.
Yeah.
So we've really advanced our understanding in the whole embedded UTI, because a lot of women will have a UTI, it will come, it will go, it will either go with or without antibiotics, and the inflammation resolves and they feel better, and that's kind of gone. And that's just what we call a standard UTI, really. And lots of women get that for lots of reasons. But when it becomes embedded, we're much more advanced in our knowledge now of embedded UTIs. So it is believed, so let me explain what embedded UTI is. So it's where the bacteria doesn't live in the urine, which is why it gets missed on a dipstick test, but it embeds itself into the bladder walls, or at worst into a biofilm. Now, what a biofilm?
It's quite deep, isn't it, through the bladder wall?
So a biofilm is a colony of bacteria. So you imagine you've got like a little colony here, and then you've got, I like to call it a cling film covering that covers it up. It's like a slimy matrix. It's like soup, like a glutinous soup caught in a cling film layer. That's what a biofilm is, and it attaches to surfaces. But what it does is it protects the bacteria in it. So the bacteria are quiet. They're quiescent. They're not classed as dormant. And when they get to a dormant status or a quiescent status embedded into the wall or in a biofilm, they won't respond to antibiotics. So that's hence why antibiotics, if they're in a biofilm, it just doesn't touch it. Or if
okay, that's interesting then. So why can't the antibiotics reach that biofilm?
Because they effectively have got a cling film covering, so the antibiotics will effectively bounce off it. But because the bacteria in the biofilm are quiescent, antibiotics will not work. They only work on metabolically active bacteria.
Yes.
And in the biofilm, they are quiescent.
So although they're not metabolically active, these bacteria, they're still capable of causing an infection.
Yeah, they are, because at some point what will happen is the biofilm will open up, it will let some bacteria out into sort of the main area, and of course they can then go on to cause infections.
And that's nasty. That is nasty.
Biofilms are incredibly clever. I mean, bacteria are incredibly clever in terms of just trying to evade things. And they're always trying to evade antimicrobial resistance. So they're incredibly clever. So that's what happens with a biofilm. And then, of course, it gets missed on culture. Now, your original question about asking about interstitial. So interstitial cystitis is another type of diagnosis, which up until now has kind of been, it's like IBS, it's a diagnosis of exclusion. We've checked you don't have bladder cancer, we've checked you don't have this, we've checked that your bladder's okay, structurally. So you've got IC, interstitial cystitis. But what we understand now is that the leading cause of interstitial cystitis is recurrent UTIs. So what recurrent UTIs are is they're effectively embedded UTIs. So it's where the symptoms are positive in the woman or the man. Symptoms are positive, but the culture is negative. So effectively, it's not a bacterial infection because the culture is negative, but we know that it is. And it's believed from some of the latest research that Professor Malone-Lee has done is that 50% of dipstick tests are inaccurate. So actually someone has got an embedded infection, but it's not being caught. Because if that bacteria is hiding in the biofilm or it's hiding in the bladder wall and they're quiescent or dormant, the antibiotics are effectively not going to work. So it's really quite scary. And you can have biofilms everywhere. You can have them in the gut. You can have them dental biofilms, are really well known. You can have biofilms in virtually every tissue in your body, which is quite scary.
So how can we help these women who have, you know, recurring UTIs, recurring infections? And I suppose that's moving on to the vaginal microbiome test, really. Well, we can look at, sorry, you did mention, does HRT have a role in preventing UTIs?
Yeah, let me go back to the recurrent UTIs before I come on to that, because that explains a bit more. But the recurrent UTI is often the same bacteria, just causing a problem. So it's not a different set of bacteria. So when you have a one-off UTI, you have one and maybe you have one 6 months or 8 months later, it's usually a different bacteria that's caused it. But with recurrent, it's like it never went away. And this is where they go dormant or quiescent. And for recurrent UTIs, all women at any age can get recurrent UTIs, or men too. But in young women, it tends to be microbiome driven, and often by sex. Sex is usually the trigger for women. In postmenopause, then hormones increase that risk as well. But Professor Malone-Lee, who is he died about a year ago.
I know.
He's seen as God by many women with recurrent UTIs. He really is, and he's really pioneered the research at UCL with embedded UTIs. And what he looks at, he understands the fact that dipstick tests are useless. Well, not useless, but I think he will say that they're not valid and they're not reliable, because he looks at white blood cells, he looks at pus cells. So he's looking to see if there's active inflammation there, because he's saying if there's active inflammation, there's going to be infection. And his way of treating it is by using prophylactic antibiotics. So prophylactic antibiotics are low dose, long term.
Yes.
Usually in the form of cefalexin. That's usually the common one at the moment. And what he's aiming to do, or how he explains it, is he explains that the bladder wall is like 5 cells thick. That's how he explains it. And then over the top of the cells, the urine washes away any bacteria. That's how he explains it. And he says that prophylactic antibiotics are needed for over a 100-day period to basically slough off the top layer into the urine, then the next, then the next, then the next. It takes 100 days to get down to that 5th layer to slough it all off in urine. So that's his view on the use of prophylactic antibiotics for recurrent UTIs in women. And I do have a lot of women that come to me that have been on the prophylactic antibiotics, and they're scared to come off them.
They didn't come off them. No.
And they're scared to come off them even after. So what Professor Malone-Lee is, he looks at their pus cells. So when he says, okay, there's no pus cells, your white blood cells are low, there's no inflammation, fine. And then if they're working with me at the same time, we're then building up the vaginal and the urinary microbiome, and then we can wean them off, which is good.
It's fascinating. Yes. So back to the HRT then, and a role in preventing UTIs. But for you, it's diet and lifestyle first, isn't it?
Yeah, without a shadow of doubt. So HRT is useful in vaginal atrophy, which of course is often a cause of the UTIs. Diet and lifestyle, without a shadow of a doubt, first. And that's the most important thing. I'm always wanting any person to be trying to optimize their diet and lifestyle before they go and looking at medications. Because medications can be fantastic in many cases and life-saving in many cases, but we always want to make sure that we're doing what we can before we introduce medications, because every single medication always will have some risk.
Yes.
So really important we look at that. If you are getting recurrent UTIs and you've done everything else that you can, then yes, look at vaginal estrogen first, and then potentially systemic if it's not resolved rather. But certainly you need to be looking at the risk versus benefit scenario in when you're going towards systemic HRT.
Okay, so before we go on to how we can give our vaginas some TLC and what women can do to reduce their risk of getting UTIs and infections, tell me a bit more about the vaginal microbiome test.
This is really exciting. We've had this out for about 3 years now, so we know them really, really well. And what we're looking is for any woman that's had thrush or bacterial vaginosis or an infection, they don't know what it is, if there's any issues with infertility, miscarriages. What we're looking for is, first of all, we're looking for the abundance of the lactic acid bacteria. So we're looking for 4 key species. They're called Crispatus, Caseri, Iners, and Jensenii. And every woman and every race, interestingly, is different. So, for example, African women have more diversity in their vaginal microbiome, which we don't want, and therefore that makes them more susceptible to vaginal infections. So that's really interesting in terms of the race. We're also looking at pH. So there's a little pH stick in the test, and we're looking for 4. And we're also looking at an inflammatory marker, and that's called interleukin-1 beta. And that's basically just trying to tell us if there's inflammation in the tissue, because that can mean that we're looking at something like aerobic vaginitis, which is a different type of bacterial infection that's more inflammation-based as opposed to bacteria-based. And then, most importantly, what we're looking in this test is the balance of the bacteria. So we're looking for the dysbiosis, but we're looking for the most common ones, the bacteria that might cause what we call VVC, so that's vulvovaginal candidiasis or thrush. We're looking at bacterial vaginosis. We're looking at aerobic vaginitis, which is inflammatory, hence the itis on the end. And we're also can look at cytolytic vaginosis, which is like an overgrowth of the good bacteria. So there's lots of different itises and otises that we can look at. Yeah.
So they get this kit through the post then, do they, Jane?
Yeah, they get the kit through the post, and it's a really simple, easy swab test. It's just one swab into the vagina, wave it around, just get some vaginal cells off there, pop it in a little pot, and send it back to the lab.
And did you say a dip test as well, urine, or just a swab?
No, it's just a vaginal swab, this one.
Okay.
Yeah, just a vaginal swab. And what it does is it differentiates between some of these vaginal infections. So what it helps us to do as practitioners is to tailor support with oral and vaginal supplements.
And this is something that's not available on the NHS. It's purely private.
No, it's purely private. It's based on the research of the microbiome companies. The particular company, the lab that I use, they're really experts in the human microbiome generally. So they also do an oral microbiome test as well. So it's really interesting, the whole thing, because the vagina is such a reservoir for bacteria, which can migrate to the urethra and then cause UTIs. So it's common after sex, which is why we often say urinate after sex, because you're trying to flush out any bacteria that might have got into there. But what's really interesting with the research on the vaginal microbiome is there is a particular bacteria called Gardnerella vaginalis, and it's the one that often can cause BV, but it can be a trigger for UTIs by being in the vagina. Now, it's really clever, because what it does is it does this covert pathogenesis. So it kind of like causes the problem and then flees the scene. This is what it does. So Gardnerella vaginalis comes along, it's very present, causes some of the cells to slough off in the vaginal, in the bladder wall.
Yes.
E. coli comes out of hiding, causes a UTI, and then Gardnerella fleds the scene, nowhere to be seen, and poor old E. coli gets the blame.
Ah, oh,
So
they're clever little critters, aren't they?
they're just so clever. So what it means for us is that if we're looking on the vaginal microbiome test and we see that Gardnerella vaginalis is there, and we also have a client that's having UTIs,
Yes.
we can see that the link. So yeah,
But
it's really
it may not be the E. coli that's causing the UTI.
no, poor old E. coli gets the blame when actually it shouldn't all the time. But it's a very easy swab test. It's you need to be off any sorts of antibiotics or antifungals for about 2 weeks and probiotics for 7 days, just so we can see what your resting microbiome is like.
I'm just thinking out loud a minute. So we know that intercourse can increase the risk of a woman getting a UTI because the E. coli can be pushed all into the vagina and the urethra by the penis. But you know, if a woman's got a dysbiotic vagina, can it affect? Can it translocate? You know, down the man's penis, and cause him and increase his risk of getting a UTI?
It's
I'm
a
just
very
about it.
Yeah, it's a very good question, and the answer is probably yes. I don't
Mm,
actually know, because we do have a penile microbiome as well.
yes, yes.
So of course that's
They're
really
all
important.
related to microbiomes, aren't they?
Yeah, and we do know in the research that a partner can keep reinfecting a
Yeah.
woman. So yeah, in theory, I guess that can be the case.
So it's important for a man to have a wee after he's had
Oh
intercourse.
yes, definitely. Both sexes definitely, yeah, definitely should always have a wee after sex.
Right. So you've explained the vaginal microbiome test, and women can access that via you. They can contact you, and you can share your contact details at the end of the video, Jane. So, what is the urinary microbiome test?
Yeah, no, this is really exciting. So this has kind of grown out of the vaginal microbiome test with everything that the research has understood on the vaginal microbiome and the translocation issues between the gut, the vagina, the urinary tract. It's only been out literally months. I've done it on myself. I've done it on 2 clients so far, so it's brand new.
Okay.
It's really, really exciting because it's for women that have UTIs, urinary urgency or incontinence, any types of bladder or kidney infections, or if they've been diagnosed with cystitis or interstitial cystitis or bladder pain syndrome or any of the other names that they're given. And we're looking for the similar species, the protective species to the vagina, so the lactobacilli, so that they pretty much do the same thing in the bladder. So we're looking for those as well. However, there's one of them that's called Lactobacillus iners, which also is in the vagina, but in the bladder, it's even more beneficial. So it's definitely one that we want to have in there. And luckily, this one's quite commonly found in postmenopausal women.
Okay.
But then with regard to the not so good bacteria in there, we have what we call pathobionts. So these are like opportunistic bacteria. So not necessarily disease causing while they're sitting in the bladder, but they can become so if the environment makes it that case. So if our pH alters or if there's other things going on. So what's really important is we look at the overall abundance and the context of everything. So like whenever we're reading any test, we don't ever look at one thing in isolation. We're looking at where's the inflammation coming from, what's the pH doing, which pathogenic or potentially pathogenic ones have we got here, has the client got recurrent UTIs, have they had a catheter at any point, because catheter associated UTIs have different ones. You can get biofilms on catheters because it's a surface. Have they got urge incontinence? So it's really important we look at the whole area.
So silly question. I understand with the vaginal microbiome test, it's a swab. That's quite easy to do. But how do women? Well, I'm assuming it's not just women, this test, is it, or is it mainly?
Yeah, no, it is just for men. It's not, the test has not been validated in men.
Okay.
So this one is typically.
So when women get this test through the post, what do they do with it?
It's like it's called it's got a little trademark name. I think it's called Easy Peasy or something.
Right.
And it's basically, I've done it myself. It's a really simple little It's a very strange looking little thing that has a loop like that basically you wee into. It
Oh,
takes
we're not
yeah.
sticking something up there.
Yeah, no, sorry. It's just a urine test. You basically urine into a little pot. It takes away your first part of your urine. It takes what's the sample of your midstream urine, which it was, and then you basically just have to pour that into a little pot. Stick a lid on and stick it in the post.
So they want the midstream urine.
Yeah.
And why is that then?
I don't know. I'm presuming. Because the first part, I believe it's because the first part could have any bacteria that it's got on the outside, on the vulva, or outside on the urethra. So they're wanting to catch what's actually in the microbiome. But it's a very easy one, and it's best to test when people are having symptoms. But let me go back to that covert pathogenesis, that Gardnerella vaginalis that causes problems and then blames E. coli. Because the research on the urinary microbiome, and this is literally the last couple of years, suggests that E. coli has often got the blame for things because it's been the only thing that's been able to be cultured. Because in the NHS, you're only going to get what you look for.
Yes.
So E. coli is often what's looked for because it's understood to be part to blame, say, 80% of UTIs. But this new research is showing that other bacteria are present in these disease states, and that's what we're looking for on this test. So not only Gardnerella vaginalis, which is in the vaginal microbiome, but some of the other ones that we find, some other species and strains that we find that might be associated with recurrent UTIs or catheter-associated UTIs or urge incontinence. So it's incredible what has actually been found. And those are what are called pathobionts, so they might not cause a problem in some women, but when they are pathogens, they are more likely to be disease causing. So we all know E. coli, and the virulent form of E. coli is called the uropathogenic E. coli. So
there are different strains of E. coli as well.
Yeah, there are, and the really virulent strain is UPEC, uropathogenic E. coli. And you've also got other ones that migrate from the gut, so they can cause problems in the urinary tract. So things like Citrobacter fruндii, Klebsiella pneumoniae, Enterococcus faecalis, and Proteus mirabilis. That they're an example of some of them. So they're ones we commonly see in the gut microbiome, but can cause really problems. But it's a super simple test. You have to be off antibiotics, and also Hiprex. Hiprex is a medication that's used for women with recurrent UTIs that is like an antiseptic. It's not an antibiotic, it's like an antiseptic. So you have to be off antibiotics and Hiprex for 2 weeks and then a week off probiotics. And both of these tests, both the vaginal and the urinary microbiome test, they're not about looking for any particular bacteria and blaming that. It's always reading it in the overall look. We're looking for the balance, the terrain. How is the host's immune system working? Is there inflammation there? What the pH level is? What the bacteria? How many of the pathogenic bacteria are present? How many of the beneficial bacteria are present? And that's why I do those tests as part of a program, because the real benefit of doing those tests is the experience and the knowledge of the practitioner explaining the test and then knowing what to go and do with that information.
Yes.
That's an information. What to do with the information.
With you being a natural health practitioner, a nutritional therapist, if a woman comes to you displaying these symptoms, recurring UTIs, for example, you would talk to her about the vaginal microbiome test. And maybe the urinary microbiome test, both of them as well, depending on what symptoms that they have. But you would always be looking at supporting their immune system overall. Would you be doing any extra tests, Jane, to check the status of their immune system? Or would you just go by symptoms alone, your health questionnaire? What's on your health questionnaire?
Yeah, it depends where the symptoms are most presenting. So most people come to me for gut issues. So I'm usually doing a gut microbiome test because that's kind of the first basis. And if we want to look after our vaginas and our urinary tract, then the gut is the first place to start. So that's usually where I tend to do that. If a client has more bacterial vaginal infections or is of childbearing age and are worried about miscarriages or that, then we'll probably do the vaginal microbiome test. If it's purely UTIs, particularly recurrent UTIs, then we'll be doing the urinary microbiome test. So we kind of pick really carefully which one is most appropriate for the clients and their symptoms.
Okay, so how can we look after our vaginas? Well, not just peri and menopause, and young women as well.
Absolutely, we need to be looking after them from the very, very beginning.
Yeah.
Absolutely, whatever age. So number one is one that we don't really think about, and that's avoid smoking. And you really wouldn't think about that, but nicotine has a really negative effect on the vagina. So if you're smoking, try to give up. There's so many other health benefits, obviously, to giving up smoking anyway, but certainly when it comes to vaginal health, definitely.
Well, it affects the blood supply, doesn't it? So that's going to affect the tissues in the vagina. But yes, all the toxins in cigarettes as well.
Yes, I'm sure it's multifactorial, to be honest, the reasons behind the nicotine.
Yeah.
But the underwear is really important. So cotton underwear, none of these sort of frilly polyester type underwear. It's just keeping away from those. Certainly okay for special occasions, but trying to keep your daily underwear to cotton. At the very least, the gusset being cotton. And the really important thing is avoiding those G-strings. Yeah. So any types of thongs, G-strings, not only are they extremely uncomfortable, but if you think about them, right up there in the vulva, right up there in the anus, and then they so easily can translocate that bacteria from the anus. So
I know they're terrible. I mean, going back to my little granddaughter again, her mum bought her some fancy knickers. Now that she's toilet trained, and I thought, she's not wearing those when she comes to grandma and granddad's house. Into Marks and Spencer's and just bought her some 100% plain white cotton knickers.
Yeah, absolutely. That's definitely the best from a point of view of underwear. The other thing in terms of looking after our vaginas is that the vagina, so the internal part, is self-cleaning. It doesn't need cleaning. It's totally self-cleaning. The vulva, so the external part, definitely can have a little bit of a wash, but sometimes water is enough to wash with it. And certainly we need to be using very, very gentle natural products. We can just use coconut oil. That can be very soothing as well if the vulva feels a little bit sore or dry. But probably the most important take-home message of looking after our vagina and giving it TLC is avoiding anything like douches or chemical products, or putting any of these, I don't know, femme smell things and everything like that wants you smelling of roses. We don't want any of that. A vagina should smell like a vagina. It shouldn't smell like a pot of roses. So
it is important, like you say, to wash the outside, the vulva area, because if you don't wash it, then how do you know if there's any changes there, any lumps and bumps that shouldn't be there?
Yeah, absolutely. But you don't need to be washing it with anything harsh and chemical at all. You can use natural pH balanced types of products, and sometimes just a little bit of coconut oil, so it doesn't need lots. The other thing that you talked about before was making sure that you change your sanitary protection really regularly. So whether that's a period cup or sanitary towels or tampons or any types of the pads, just making sure that you're not leaving them on too long, and then they're not getting too warm and a humid environment, which is what things like thrush like.
And of course, it can cause toxemia, can't it? Like
toxic shock, yes, certainly for tampons left in, yes, definitely. Yeah. So changing those, and then diet, obviously important for me as a nutritionist. But the amount of women I've had come to me that have over-restricted their diet, they followed an anti-candida diet, which I don't recommend. Basically, what happens with the fungal, so if it's a yeast infection, so such as thrush, it's fungal. And if a fungal turns into what's called a hyphae form, it develops little claws. So it's like a very virulent form. It affects claws and it can dig into the epithelial walls. And that causes damage. If you think of, digging into your epithelial walls and pulling things off, it causes real damage. So we certainly don't want to be restricting the diet so much that they have to grow into a hyphae form. So we want to be making sure sugar is low for sure.
Because they will adapt as much as they possibly can, won't they? Like bacteria, they'll find a way around it.
They're incredible. If they don't have sugar in your diet to eat, they'll go on and eat your fat and your proteins. And then they leave you malnourished. So they're incredibly clever. So we don't want to over restrict them, but we certainly want to restrict sugar. So refined sugar, simple carbs. And what I mean by simple carbs is white rice, white bread, white pasta, and alcohol, because that's a big form of sugar. So that will also depress the immune system. So those are the things that we want to keep away from, but more importantly than what we want to reduce is what we want to increase or to make sure there's more there. And that's really very much my focus as a nutritionist as to what we're putting in. So we want that wide variety of colour for the microbiome, for your gut microbiome, which of course in turn will help your vaginal and your urinary microbiomes. We want prebiotic foods and probiotic foods. We want plenty of fibre, both soluble and insoluble. And probably the most important thing is we want natural foods. We don't want any ultra processed foods. And you only have to walk down our supermarkets now, and the amounts of ultra high processed foods is huge.
Just as an aside, Jane, I've been reading some research about acid reflux, Barrett's esophagus, and esophageal cancer, and affecting people in their 30s now, much younger, when it used to be Barrett's esophagus used to be a disease that affected 50 plus, and the rates of Barrett's esophagus have doubled in the past 10 years. And they think the research points to it being ultra high processed foods, because these ultra high processed foods contain acids. All the chemicals that are in them are acidic, so you're ingesting those and you're just adding to the acid in the stomach.
You are, and also they're very high in emulsifiers.
Yes.
And emulsifiers are like washing up liquid for the gut.
Yeah.
So if you imagine you just pouring your fairy liquid into your gut, that's just awful. And that's why they also believe part of the rise in inflammatory bowel disease is down to emulsifier use in processed foods. So yeah, without a shadow of a doubt, any food that comes out of a factory, not from an animal or from a plant, be super careful about putting it in your body, because it will have some sort of negative effect.
Yes. Okay, so what are ultra processed foods, UPS. Right, so what can women do to reduce their risk of getting a UTI? Recap on
so the number one thing for helping urinary health is to sort your gut and your vagina first, because they are the two big reservoirs that will affect the urinary tract. So straight away you go for everything to do to sorting your gut, everything to do with sorting your vagina and getting those microbiomes sorted first. That's kind of number one. Don't skip to the next step. So all of the diet stuff we've just mentioned. It's really important that you don't hold your urine back. We want to make sure that you go and have a wee when you need to and don't rush off the toilet. So don't sort of leave drips behind. Although interestingly, Professor Malone Lee says that he thinks it's a load of rubbish that bacteria might get caught in when you just don't finish off having a wee. But for me, it kind of makes sense to make sure you've finished a wee and not just leave any in there. Research or not, it makes sense to me. So I think that's important.
Well, I think the longer it's in there, the more opportunity the bacteria's got to multiply and cause a problem.
Yeah, I think so. The next thing is to drink enough water. So your urine should really be straw coloured. So we don't want too much water in, but we don't want too much. We don't want too little. So there's no benefit in just drinking gallons. But we certainly want to keep well hydrated for lots of other reasons, not just for our urinary tract, but because our water is really responsible for delivering our vitamins and minerals around in our water. And then for UTIs, well, just like for the vaginal microbiome and the gut microbiome, it's all about supporting your immunity as well, because we know, don't we, that about 80% of your immunity is held in the gut. So when the gut is working well. So probably the two most important things that we can do to help our immunity is to support our stress levels. And for women, this is a biggie often because they're so busy looking after other people that they're not putting themselves at the top, which actually they should be putting themselves first. So it's making sure that the macro and the micro stresses, I call them. So the macro stresses are the big stresses like relationships or your jobs or things like that. The micro stresses are little things like, has the cat done a wee on the carpet, or have you got your phone constantly pinging because the WhatsApp group is going? It's really important to manage both of those as much as you can. A lot of the little micro stresses you can get rid of by muting your WhatsApp groups and things like that. So managing your stress is hugely important, and women need to be reminded
constantly.
Because
they're not very good at it.
They're not very good
from personal experience.
We've all got to stages, and I think perhaps as we get more to our age, Linda, we're better at it. I know I certainly am. I do put myself first, because I know I put myself first, I can look after everybody else much better.
Well, you go golfing, don't you? You love your golf. You've got your lovely dog, and you take. Is it a him or a her? I can't remember.
Yeah, he's a boy sitting down there now. Yeah, he's and I've got my golf, and I belong to a choir, and I do Pilates, and I walk the dog. So it's really important that women find things that they really enjoy that let their stress out.
I've joined a gym, a ladies only gym, and I absolutely love it there. Not just for the exercise, but for the friendship as well.
Yeah, and actually connection's really important for everybody, not just women. That connection of feeling that you belong to something, or that you've got friends, really important. So stress is hugely important, but also to support immunity is sleep. And women tend to get by on a little bit of sleep, but actually we don't need to get by. We need to really maximize our sleep. We need a good 8 hours really to sleep. 7 or 8 hours, really important. And we really want uninterrupted sleep. We don't want interrupted sleep. We want it uninterrupted. So that's really important.
There are times in our lives, Jane, when it's just not possible. For example, when my dad died, it affected me quite badly, as it would, and that affected my sleep for several months. As it would. So I think there are times in our lives when we can't always get that good quality sleep.
Yeah, of course, that's always going to be the case, particularly as if you're a sensitive character where things will upset you. So say it's an argument with a friend as to losing a parent, which is huge. And that really will dent your immunity as well, because that's a big stressor. And of course will affect your sleep. But it's even more important during times like that to look after your stress and to try and focus on your sleep, because you need supporting even more at that time. So yes, there's always going to be times that we don't sleep as well, or we have stresses that are very difficult to resolve.
Yeah, I really had to pull on, my internal reserves to get through that.
Oh, totally. I've so been there. I understand that. But the thing with diet for the urinary tract is pretty much the same as what I've said to you about the gut and the vagina. However, there are some extra bladder irritating foods that can cause issues. Now, particularly when someone's in a flare, definitely take them out. But when you're not in a flare, or if you're not having recurrent UTIs, then perhaps just see how you go with them. But alcohol is number one for that, sadly. Caffeine is another drink that's very acidic to the urinary tract. And then spices, chili, and things like cayenne pepper, or any of the really spicy foods, they can be quite irritating. Again, not everybody finds all of them irritating. Everyone's different. So someone might have a problem with tomatoes or with citrus fruits. My problem was always citrus fruit and alcohol. So those are the bladder irritating foods that are quite useful to keep out if you're having a flare.
But we know, don't we, Jane, going back to what you said earlier about smoking and alcohol, that smoking and alcohol increases the risk of bladder cancer, doesn't it? The research, the data is there. One other thing as well with regard to UTIs that I always advise women on is to avoid getting constipated, obviously.
Yes, very
because if the bowels are getting full of feces, not only is the translocation issue, of course, but the pressure from the bowel pushing against the bladder can affect the emptying of the bladder. So, the women can get retained urine. Again, the E. coli becomes more constant. If urine is concentrated, the E. coli can multiply. So it's always, best to get the bowels emptying regularly.
Yeah, that's really, really valid point. And then hence going back to the fiber I talked about and the prebiotics and the probiotics in food, that's really important for keeping you moving, so that you're absolutely right, because you don't want stool sitting in your digestive tract for too long. Yeah.
I think it's next month on the 16th of February. I'm going to be doing another video speaking to a specialist pelvic floor physiotherapist. The name's Lizzie. And we're going to be talking about, the importance of the pelvic floor, prolapses, things like that. So that should be very interesting. So supplements to support immunity and to support the bladder and the vagina and the urinary system. So as you know, garlic's a good one for immunity. And I have a garlic supplement, my Just For Tummies garlic.
Yeah, so the garlic is fantastic for immunity generally, but also because it's antibacterial, so it's great. It's like a natural antibiotic, so that's a really good one if any women are having any vaginal infections or any UTIs or any gut disturbances as well. That is a fantastic, the garlic, your Just For Tummies garlic.
Yes, yeah. And of course, omega-3 essential fatty acids.
Omega-3 is great from a perspective of that it's anti-inflammatory, so it's can help to reduce the inflammation pathways, particularly if there's any soreness or real discomfort with regard to, they're usually bigger ones, aren't they? With regard to, it's also hormone supportive. It's great for stress, managing stress as well. We love omega-3 for that reason. And also, of course, it's lubricating us from the inside.
That's right. That's what I often say. And what's your take on omega-3s from fish oils and vegan omega-3s, Jane?
Well, I'm a big fan of fish oils from fish.
Yeah, me too.
Because they just have far better oils. If you think about the oil coming out of a fish or a meat, and you think of oils coming out of a plant, it's never ever going to be the same. No. It's just not. So I'm a big fan of fish oils.
Yes, me too.
Really big fan of fish oils. Yeah.
And finally, probiotics. Strain-specific probiotics. Yes.
So there are your full women probiotics. So those are the lactic acid. So in your strains, you've got reuteri, lactobacillus reuteri, lactobacillus rhamnosus, and lactobacillus acidophilus, haven't you?
Right. Yes.
Yeah. So those are fantastic for any vaginal and urinary issues. Mm-hmm. Really important, because the research has shown that those particular species and strains will get straight into the vagina. They will be delivered straight into the vagina where they're still alive.
Yes, yeah. But they also help women who suffer with like IBS. And constipation as well, because they act in the gut, as you know, not just on the vagina.
Yeah, absolutely, they do, and that's where I suggest that the live bacteria as well, your standard live bacteria, are also good, because we want to get the gut in the best position it can be, and we want to avoid any translocation issues from the gut through to the vagina and the urinary tract. So in my view, if a woman's having issues with those, she should probably use both of those, maybe alternatively.
I often recommend a live bacteria before breakfast and for women before they go to bed. I have a lot of women on that protocol with a daily omega-3 and a daily garlic as well.
That's a perfect protocol. And to be fair, for most women that have one-off UTIs or one-off thrush, or they just get a little bit out of balance, that and eating sensibly is probably going to be more than enough for most people. And that's fantastic, because it just means that you can get to a wide audience. And I use a lot of your supplements in my clinic all the time, so I know that they work. But if you're starting to get real recurrent things and lots of other multi-symptoms that you're getting, then it's probably best to start getting tested and to work with a nutritional therapist that's ideally specialist in the whole microbiome, so the gut, the vagina, the urinary tract.
I absolutely agree, Jane. So if you can let people know, let women know how they can contact you.
Okay, well, the easiest way is to look at my website. That's nurturingnutrition.co.uk. And on there, I have everything. I have free resources. You can sign up for my newsletter. I have some.
Newsletter is great. What's it called? Your news? Is it?
It's called the Micro Change Digest.
I love that.
Yeah.
Is that weekly?
It's actually every other week, but I'm probably going to make it weekly now because people love it. And the idea of that, funnily enough, was somebody said to me once, I'm fed up with you nutritional therapists telling me to give up gluten and give up dairy and give up alcohol and give up chocolate. I want a tiny micro change. I can just make it, I thought, oh, that's a great idea. So hence the Micro Change Digest was born. And it's just generally a read in less than 1 minute. It's a quick tip, and it might just be on talking about the benefit of berries today, or I might be talking about the benefit of drinking enough water or something like that. But that's for people that want free resources from me.
And when they're busy and they've only got about 5 minutes to read something and absorb it.
Exactly. So it's a read in less than 1 minute generally, and it's something that they can quickly read and go, do you know what? I can do that. I can just go away and have some raspberries today and increase that. That's the idea of it. So I've got lots. So my website, they can sign up for my newsletter. There's free resources, free ebooks, free podcasts. Yeah. There's my meal plan. There's a course, or they can submit a form to have a free chat with me if they want to work one-to-one. So everything is on my website.
Your website. Your micro digest that you sent out last week, the one with the images of those legs, those ladies.
Oh yeah,
those 3 images. Did you get my email? I emailed you, and I asked if you share that on Tummy Talk.
I'll happily. Do you know, that was a client, funnily enough, from about 8 years ago. And I spoke to her last year, and her psoriasis has never come back.
It's amazing, the difference.
8 years on. And what I love about that photo is that you could see she literally had these Barbie pink blobs on her leg.
Yes.
And then 5 weeks later, they were pale pink. And then they had completely gone in 5 months.
Yeah, she got a cracking pair of legs as well. I wish I'd got legs like that.
Pair of legs. And she sent me a photo at her son's wedding the following year, where she had this beautiful outfit and her legs looked amazing. They were lovely, tanned and looked beautiful, and not a patch in sight.
So that's what it's all about. Yes. So when you get a chance, I know you're a really busy lady, but
I will do
that. Share that on Tummy Talk.
I promise.
The members would be really interested in looking at those photographs in particular. Yes.
Yeah, I will do that.
Right. So I won't keep you anymore, Jane. We've gone over time.
But it's so much to talk about when we get together, isn't it?
Fascinating, interesting information. So thank you so much. I will be sharing this video. I'll be sending it out in a newsletter to my database. I'll be sharing all over social media. It will be in Tummy Talk. And linking to your website.
Let's get the word out there. Get the vagina word out there.
Absolutely. Thank you so much, Jane.
Pleasure.
Lovely to talk to you.
Pleasure.
Bye for now.